Hello friends, as you all know, today is 21st March, which is also celebrated as World Down Syndrome Day. So, all over the world, events are held to amplify the voices of people who have Down syndrome, with this year's theme being End the Stereotype. So, this is an attempt to reduce the stigma that people with Down syndrome cannot achieve or succeed like their peers. The colors for Down syndrome awareness are blue and yellow. Down syndrome is basically trisomy 21 or the presence of an extra chromosome number 21. And the incidence is about 1 in 800 to 1000 live births. It is the most common trisomy at birth and its incidence increases with the advancing maternal age. Regarding genetics, it is due to error in cell division at the time of conception, that is non-disjunction, and it is responsible for 92% of Down syndrome cases, resulting in full trisomy 21. Talking about the aneuploidy testing, there are two major types of tests. First category will be screening test, second will be of diagnostic test. Screening test includes first trimester screening, second trimester screening, combined first and second trimester screening, and cell-free fetal DNA detection. Whereas diagnostic test will be more reliable and it is of two types. First, that is chorionic villus sampling, and second, that will be amniocentesis. Now we will talk about the screening for chromosomal abnormalities or aneuploidies. It is important because we can easily detect and we will give the couple the option to terminate or whether to continue the pregnancy at the earliest time. So in this there will be first trimester screening which will be done between 10 to 13 weeks of gestation, and in this two things are done. First, ultrasound which will measure the tissue behind the fetal neck, that is known as knuckle translucency. Second, that is serum markers or dual markers. These includes PAP-A and HCG. Second trimester screening will be done between 15 to 22 weeks, and this will be done using 4 serum markers which are quad screen test. And these include maternal serum alpha fetoprotein, HCG, unconjugated estriol, and inhibin A. Third, that is combining first and second trimester screening. And fourth, that will be cell-free fetal DNA, which detects the small amounts of fetal DNA in maternal serum. Now, talking about the ultrasound findings in fetuses of Down syndrome. First, thickened knuckle translucency is seen at 11 to 14 weeks in 80% cases, and in 10% there will be cystic hygroma seen. Second, that is thickened knuckle fold more than 6 mm at 16 to 23 weeks. Third, that is congenital heart disease in 40 to 50% cases. Fourth, duodenal atresia. Fifth, omphaloceal, and sixth, ventriculomegaly. And seventh will be soft markers which are short humerus and femur, echogenic bowel, short ear length, pilectasis, cardiac, that is usually left ventricular echogenic